All right, why don't we go ahead and get started. First, let me thank everyone for coming out this morning. First, I'm going to, the way we're going to do things is I'm Delegate Patrick Hope. I'm going to bring in some folks, some parents that have a child with intellectual disabilities. We're going to have someone from the Medical Society of Virginia come up and speak, and we're going to have someone from the American Cancer Society to come up and speak. I have Delegate David England and Delegate Labarto here to also, if they wish to make some comments. So again, thank you all for coming out this morning. Let me tell you a little bit of background about me. I've spent 16 years in healthcare policy at the federal level, analyzing Medicare and even Medicaid. And I even teach a course on healthcare policy and have done so for 5 or 6 years. And this is my first term in the Virginia General Assembly. I've now had a year to really analyze the Medicaid budget. I've done it from the perspective as a delegate, as a member of the Health, Welfare, and Institutions Committee, and also as a member of the Virginia Health Reform Initiative, the governor's task force to look at the implementation and improvement of Medicaid. And during that time, I've had a chance to take a hard look at our Medicaid program, and the statistics are very staggering. Virginia's Medicaid program is facing a fiscal crisis. The budget is on an unsustainable course to bankrupt our Commonwealth unless we are willing to take bold and decisive action to preserve and protect the Medicaid program for future generations. Here are the facts. Virginia's Medicaid budget has grown by a staggering 1,600% in the last 27 years. It's going like this if you're looking at the chart. Medicaid represented 5% of our budget in fiscal year 1985. It is now over 21% of our entire Virginia budget in fiscal year 2012. Reimbursement for hospitals and doctors is scheduled to go from 72 cents on the dollar last year to nearly 64 cents in fiscal year 2012. Doctors are being forced to turn away patients because they can't afford to provide the patient care and still keep their doors open to operate. And we continue this antiquated policy that emphasizes expensive institutional care instead of less costly home and community-based care. All this adds up to decreased access, costly ER visits, avoidable hospitalizations, and paying for expensive services for individuals with intellectual disabilities and developmental disabilities when similar services can provide in the community at a lesser cost. My proposal will chart Medicaid on a course that will slow its growth and save taxpayers money. Let me repeat that. If we go on the direction, we continue going in the same direction we're going to keep going up and up and up and up. My proposal will slow that growth and it will save taxpayers money. My proposal will designate $254 million that will nearly eliminate the Medicaid waiver waiting list. You got to remember, when we use Medicaid dollars, you get a federal match, so these numbers will double. We'll designate $159 million to increase reimbursement for Medicaid providers. This is also a priority. We'll designate $31 million to fund tobacco cessation and prevention programs. My proposal pays for all of this by bringing the tobacco tax in line with the national average, from 30 cents a pack to $1.45. Just the national average. It's not the highest, it's not the lowest anymore. It's now the average. Smokers cost Virginia's Medicaid program $400 million annually in tobacco-related illnesses. And this is all related to cancers, heart disease, and diabetes. This tax on smokers will pay through my bill, will finally make them responsible for their own health care costs. At this time, I ask Rufus Phillips, from the Executive Director of the Medical Society of Virginia, to come forward.
Good morning. I'm Rufus Phillips, Executive Vice President of the Medical Society of Virginia. It is a real pleasure to be here in support of the proposed Medicaid Preservation and Protection Act that would have so many positive benefits for the health of Virginians by discouraging smoking, reducing illness and societal costs related to smoking, and most importantly, by saving lives. The proposed legislation would accomplish some other very important things that you are hearing about today, one of which is bolstering the reimbursement rate for Medicaid providers. As a representative of over 9,000 physicians who are members of the Medical Society of Virginia, I want to share with you that we are very concerned about how difficult it is for patients who currently depend on the Medicaid program to find the medical care they need. In many areas of the state, there aren't enough primary care and specialty providers who can continue to afford care for a large number of Medicaid enrollees, which, as you all know, is only going to go up with the federal health reform. Their business models just won't sustain providing services at below cost indefinitely. It's unfortunate and personally difficult for physicians, many of whom have chosen this profession so that they could help those in need. Given the current economic climate, we expect to see even more of our fellow citizens turn to the Medicaid program for medical care. Coupled with increasing demand and an already meager reimbursement system is the approaching second year of cuts to physician payments, totaling over $14 million. These cuts have and will continue to take a toll. Over half of the physicians who responded to our recent survey indicated that this will force them to stop taking new Medicaid patients and to make personnel changes in their practices, meaning fewer jobs for Virginians. I suggest to you that what we have is, unfortunately, a perfect storm that will leave many Virginians untreated and turning to our already overburdened hospital emergency departments for non-emergency care. With a very challenging state budget and additional Medicaids coming in July, this legislation accomplishes so many positive things for the health and well-being of Virginians, from helping to stabilize the network of Medicaid providers to improving the health of Virginians through smoking cessation and prevention programs. The Medical Society of Virginia is proud to support the Medicaid Preservation and Protection Act. Thank you. And thank you, Delegate.